Welcome everyone to this evaluation webinar, which is about invitations to tender for work with small cohorts. Just to remind everyone that the webinar is being recorded. You are welcome there will be time for questions at the end of the session, but you're welcome to pop any comments or questions in the chat as we go along. That's being monitored as well. And raise your hand if you would like to ask any questions if anything's not clear. So welcome everyone. Without further ado, I will get started. So just to very briefly give you an outline of the session today. It will only be quite a short session. We'll have plenty of time for questions. So we'll be looking very briefly at the important information, bit of background to the project, an overview of the invitations to tender, and then, as I say, time for questions at the end. So the important information, the deadline for applications is at midday on the 2nd of July. Before that time, if you have any questions at all that require any kind of clarification, then please can you send those to us by the 21st of June. We're hoping to be able to kick off the project sort of end of July, beginning of August, and then an interim report will be due in March 2025. So very briefly, the background to the project. Between 2016, 2017 and 22-23 academic years, the percentage of undergraduate students at HEPS across the UK who said they'd experienced mental health difficulties rose from 6% to 16%. Which means that around 1 in 6 HE students now report mental health challenges. Despite the growing need to support mental health of HE students, there's a lack of evidence on what interventions and approaches work effectively to support student mental health. There's a lack of evidence for the majority of intervention types and almost no evidence which shows the impact of mental health and wellbeing interventions on other student outcomes such as attendance, continuation and attainment. Given the lack of evidence, we're really keen to support the sector to find out what's working well. And so we've separately tendered for an independent evaluator to run randomized controlled trials with HE providers to assess the impact of their wellbeing interventions prompted by analytics. We've also commissioned an evaluation of mental health and wellbeing interventions using quasi-experimental designs. So QEDs use methods which can establish a causal relationship between an intervention and outcomes, but they use naturally occurring or constructed treatment and comparator groups rather than achieving this through random assignment, which is what our RCTs do. But this project and the focus of this webinar is evaluating mental health and wellbeing support with small cohorts using small n methods, also referred to as theory-based evaluation methods. So looking first at the invitation to tender for evaluators, we're seeking to appoint an independent evaluator to work with higher education providers to explore the changes brought about by their mental health and wellbeing interventions for small cohorts through the use of small n methodologies. The aim of the evaluation will be to establish whether and how an intervention has brought about change, exploring those assumptions and identifying contributions to change. The final research questions will depend on the selected intervention and the evaluation approach, but the types of questions might include what difference the intervention has made, how and why a change has occurred, and what barriers and enablers can be identified to change occurring. Methods that might be employed include process tracing, contribution analysis, qualitative comparison analysis, realist evaluation, but we're also really keen to hear from evaluators who are using innovative evaluation approaches. So the list above is not an exhaustive list, it's just an indication of the sorts of methods that we're interested in hearing about. But as I say, we're also really interested in different and innovative approaches. The budget for the evaluators is £25,000, excluding VAT, per evaluation project. And as we're looking to work with 2 providers, then evaluators are invited to tender for 1 or 2 evaluations. Moving to the tender for providers. So we're inviting applications from larger HEPs that deliver targeted interventions to targeted groups of students, or from small and specialist providers that, for example, use innovative ways of providing holistic whole university support to particular groups of students. Further examples might include peer support interventions for small targeted groups, such as students from a particular group or students at a particular stage in their course, such as nursing placements. We're interested in targeted transition interventions, such as transition support for students with a declared difficulty or mental health diagnosis, recreational activities such as writing, creative therapies, outdoor activities, or animal therapies for small and targeted groups, and interventions that are designed around the particular needs of students on courses in small and specialist institutions, such as students on dance or arts courses. And again, not an exhaustive list, but it's just an example of the sorts of interventions that we're looking for. Key thing being that it's for it's small cohorts, whether that be within a larger institution or within a small and specialist provider. And the budget for providers is £5,000 per intervention, excluding VAT. Key project deliverables, so they will be a theory of change for the HEP per intervention, an evaluation protocol for each HEP, an interim report for the HEP to be delivered ahead of the break clause by the end of March 2025. And due to the nature of TASER's core funding agreements, we do have to implement a contractual break clause for the end of March 2025. After this date, we do anticipate very much that the project will continue, but we do, because of our funding, we do have to reserve the right to terminate the contract at this point. So that was a quick overview of the tenders and what we're looking for. So now I will open the floor to questions. And I can just see a question in the chat about yes, the talk is being recorded and will be distributed afterwards. So I will stop sharing.
Rather, we if I may, we distribute a frequently asked questions document, right? That's our intention, not the entire recording. Is that right, Helen? Anyway, we'll share all the questions and our responses so that all interested parties have a chance to review the information.
Cool. Okay. Any questions, feel free to unmute or add any questions to the chat that you might have, anything that you would like to find out more about. Right, Liz, please do go ahead. You're muted. Not sure. Liz Sturge, I can see a hand up, but please do ask.
Hi, apologies. I'm not sure why or how I've put my hand up, but I don't think I have any questions at this point. Thank you, though.
That's right. Okay, I can see some questions coming in through the chat. Okay. So with the HEP budget is 5K. Will you be looking for only new interventions or existing ones? I think we're looking for, and Christoph, obviously jump in if do jump in. But we're looking for existing interventions rather than new interventions, purely given the timeline. So we're hoping to be, as I said, hoping to kick off at the end of end of July, beginning of August, and to have those interim findings in March, which means that ideally we will be looking for interventions that might have been up and running for a certain amount of time, which also means that you may have some data, internal data available. It doesn't have to be as part of a formal evaluation, but ideally there will be data available that suggests that this is an intervention that works. So you have a feeling through, for example, it might be anecdotal evidence. It might be part of some evaluation process that you've already conducted, but you have an idea that this is a method that an intervention that works, and so therefore is worth conducting some robust evaluation. So I think ideally we are looking for those interventions that might have been running for a short time, rather than new, in the sense that new that they will be starting sort of in the next academic year. Does that sound right, Christoph? Do you think that we're looking?
Yeah, I think yeah, partly, but yeah, I think for us the key is that the participants that this evaluation is looking to engage will have a chance to participate in the intervention, and then there is some time for some benefits to materialize, for our evaluation to pick up the difference that the intervention make, or the benefits that have materialized. So that's the key thing. Whether these are interventions that the education provider has been delivering for a number of years already, or not, is perhaps less key. So if you are a university or provider who is thinking about launching a completely new intervention in the coming academic year, you can still put in an application to us here at TASO, but you need to provide reassurances that there will be sufficient time for participants to be exposed to the intervention, to participate in a peer group, for example, or an arts therapy, and then enough time for the evaluation to collect data to evaluate its impact, if that makes sense. So yeah, I guess slight preference for existing interventions, because with new interventions, there may be a risk that not everything is being implemented or delivered as planned, if you're planning something brand new. But I wouldn't exclude, I wouldn't want any higher education provider to exclude themselves. If you're thinking about launching something new, you just need to provide the reassurance to us that everything will be implemented as planned, and there's sufficient time for data collection for our evaluation, if that makes sense.
Thank you, Christoph. Another question, could I check, are you looking for evaluations of group interventions only? I'm not sure what you mean by group interventions, but we're looking, the purpose of this project is to evaluate interventions with small cohorts, so with small groups. So long as your intervention is either within a larger institution, but targeting small cohort. So, for example, targeted intervention supporting the mental health of care experienced students, or mature students, or students from a BAME background, then that's what we would call we would classify as a kind of an intervention with small cohorts. Or conversely, if it's you're from a small and specialist provider, for example, and potentially taking a whole provider approach to again for a particularly targeted group. But I know some small and specialty providers, due to the nature of the provider, the way that student mental health support is delivered is different from how it is in a larger provider. So we're also looking for those whole institution approaches from small and specialist providers, as well as targeted support within small specialists. But it's just that focus is that it's small cohorts. So those interventions that don't support, for example, the QED or the RCTs, which rely on much larger sample sizes in order to be able to run that type of evaluation, what we're looking for is for working with those interventions that don't have those big sample sizes, but obviously they're still incredibly valuable, and we're still very important to find out what works. So using those theory-based evaluation methods in order to be able to find out what works. So that's the key. That's the bit that we're really interested in. Are you considering universities maybe partnering with a charity, for example, who are supporting the intervention delivery? I think so. Again, if it's small, if it's again that very, very targeted. So I guess what wouldn't be so applicable would be some of the large online interventions, for example, are sometimes delivered by charities. So, or the telephone or email support. So those interventions that support hundreds and potentially thousands of students, not that, but if it's again, if it's you're partnering with a charity and it's very much focused on a very, very it's a small targeted group, then yes, we'll certainly be interested in hearing about that. HEP 5K budget, we'll be looking at only, oh no, we've had that one. Will the RCT and QD have to be different to the small N selection? Well, the intervention obviously will be different, but the HEP might be the same. Well, when we won't know. Again, obviously intervention for RCT and QD will be very, very different. QED will be looking at curriculum-based interventions, for example. So again, the key there being those where you can have the comparator groups. RCT is all about randomization. So again, those big sample sizes where you can have the control group and the treatment group.
Hi, that was a question from me. I was just trying to work out whether the actual universities themselves whether there would be any overlap between those three different types of evaluations, or are you consciously separating that?
Oh, good question.
I think that this invitation to tender is open to all higher education providers. So yeah, in principle, you can have a university applying for all three of these research grants that TESO is procuring for at the moment. So it's not the case that if there is a HEP that applied to one of our three flagship research projects, then they exclude themselves for applying for another one. That's not the case. Does that answer your question? Does that make sense?
Yes, thank you.
Thank you, Christoph. Does the focus of the intervention need to be mental health or overall well-being and improving student outcomes for small groups? Good question. That it can be either. So we are very definitely interested in well-being and improving student outcomes for small groups, as long as it's focused on those small groups. So Christoph, have your hand up.
Yeah, but continue, Helen. I just want to add some further clarification on the previous question.
Oh, sorry. So yes, as we said, there is very, very little evidence of how student mental health or wellbeing interventions improve student outcomes such as attainment, progression, retention. So absolutely, we are interested in looking at wellbeing interventions, again, targeted at those working with small cohorts that also are looking to improve those other student outcomes. Yes, definitely interested. That was from Nicole. Christoph.
Yes. So there are eligibility criteria that are different for this small N tender compared to the RCT tender. Right?
I think it was the eligibility. I think the eligibility criteria is the same, isn't it? That you have to be registered.
Yeah. So for the small N, the one that we're talking about today, the lead applicant must be a registered English higher education provider in the approved fee cap category. So that's clearly stated in our invitation to tender, just to reiterate that here. So, and also we welcome applications that involve programs or interventions that are delivered in collaboration across multiple HEPs or with other organizations. So this is permitted and very welcome, but the eligibility criteria is that the HEP has to be an English higher education provider in that approved fee cap category, and that is largely driven by our funding from the Office of Students.
Thank you. Question from Scarlett. There's a differentiation between large and small scale. Do you have an idea of size and scale that you are looking for? Small, yeah, I mean, not large scale, I guess. If we're talking numbers and sample sizes, large scale RCTs and QEDs. This is small scale, so we're talking. I mean, it's difficult to know, I guess, without knowing the type of intervention and the evaluation approach, and all of that will be decided once we have a HEP and the provider and the evaluator in place. And I'm not sure how easy it is to quantify, but it's the notion of this very targeted support. Where I would imagine you're talking small numbers. Again, it's difficult to say, but I don't know. I'd be nervous about putting a number on it. But you're talking, groups such as care experienced and mature students, students with particular diagnoses, and as the focus is on student mental health and the small groups within student mental health, we're looking at that intersectionality. Really might be, for example, looking at the student mental health of disabled students. Your numbers are going to be quite small. I think it's that group size that would define the number. But I'm not sure about putting a physical number. What do you think, Christoph, in terms of actually?
Yeah, no, I agree with you, Helen. It's incredibly hard to be very, very specific. But maybe to give you a flavor, yeah, to try and answer this question. If you are thinking about an intervention that reaches hundreds of students or thousands, that's probably not what we're looking for. Definitely not what we're looking for here in this small N invitation to tender. And we would try and apply other evaluation methods to that kind of large-scale intervention. But if you have a peer support program or targeted student mental health or well-being interventions that reach 30 or 40 or 60 students, that is definitely in scope and will be considered. Just bear in mind, for a small theory-based, small and qualitative research or evaluation project, we're looking to try and do primary data collection, perhaps with 30 participants. But these are 30 participants we want to interview for our evaluation. So if you have 30 participants in your peer group intervention, not all of them will want to participate in our evaluation. So you would need to have many more participants in your interventions for us to then go out, recruit people, and end up with a sample of about 30 participants as an indication. Okay. Yeah. So this is the steer I would give to this question. There's a hand up. Maybe we want to.
Yeah, I think that's Alec, and I've enabled the mic for Alec if you'd like to speak.
Thank you.
Hi. Yeah, it's Ali, and I think my question has almost been answered, but I guess it's around understanding what outcomes you would be looking for almost. So I'm coming from a small specialist provider. I run the wellbeing team here, and we probably see about 40% of our 200 odd students a year. And I think where I struggle in terms of what we offer is understanding what's the benefit of it in a way, because as a higher education provider, a lot of our figures are quite healthy in terms of retention, attendance, student outcomes. So would this study enable us to look at, just from the individual student well-being perspective, like are we interested in measuring the student's state at the start of an intervention, at the end of an intervention, or is it more the outcome to the higher education provider? Does that make sense?
I think it will. It's again, it's a good question. But we're looking for interventions that are targeted at improving well-being.
Mhm.
But we're also interested in how improved well-being will then also impact on student outcomes. So
Okay.
if it was an intervention that was designed to improve the attainment of a particular group of students through a wellbeing intervention, if you kind of had if you had some evidence or an intervention that was designed to improve the wellbeing of disabled students in order to improve their attainment, for example, because you have evidence suggests that it was their wellbeing that was having an impact on low attainments, and perhaps impacting progression, then that's the sort of thing that we're interested in. So it's and I guess wellbeing and mental health outcomes, it would be so interventions that are targeted at sort of improving depression, for example, looking at anxiety. So those kind of mental health and well-being outcomes. But
Okay,
then
that makes sense. Thank you.
those interventions might also be designed, or you might have found, as I said, it might be that you've found that this particular wellbeing intervention has had an impact. It might be something that you haven't evaluated. It might be something that you've noticed in your trends, in your data. Might have noticed that, oh look, when we did this wellbeing intervention, we noticed that there's the attainment of this particular group of students has gone up. So I hope that answers
Yeah, I think that does. Thank you.
the question.
Can I just jump in? Someone's asked, it's not applicable for Scottish higher education providers, and I thought it might be worth answering that now.
No, yes, sorry, no. Unfortunately.
Thanks.
What will the support from the independent evaluator look like? Well, again, that support, well, what we know at the very least that will look like, that will be working with a provider to understand the intervention, to develop the scope of the evaluation, to develop a theory of change, to work with the provider to what's the word? Not choose, to ensure that the evaluation method is appropriate and applicable for the intervention, and as Christoph referred to actually conducting the evaluator will actually conduct some of that primary data collection with HEPS and in the with the provider itself, but we'll also be interested in hearing from HEPS who might be able to provide some of that evaluation support. So perhaps through students, for example, in terms of that data collection. Again, we'll an ethics process will have to be gone through. So we'll be looking for support from the HEP in order to as Christoph said, to maybe set up some of those meetings and be the intermediary between the independent evaluator and the participants and the people that we might want to be talking to through interviews and focus groups. So that's the kind of support that the evaluator will be providing, and it will be so at by the March 2025. That the provider will have a theory of change plus an interim report on the impact so far of the findings so far of the intervention, as well as we're also interested obviously in exploring the use of these theory-based evaluation methods with the small cohorts, so with the people that HEPS will be working with. Would you anything else to add?
No.
Christoph?
No, I think that's really good. I'm happy to take the next question about the budget.
Okay.
And I could see there was another question in. something in the chat, but also in the Q&A. So one question in the chat was about what the budget is for, what it is intended to cover. So the question is, does the £5,000 cover the cost of staff time involved, or is it for consumables, and does it cover overheads? And so my answer is that the £5,000 are, it's our estimate what will be needed for higher education providers to participate in the inception and scoping time. So this is staff time. For university or providers to source and securely share contact details of participating students with the appointed evaluator for the primary data collection. So that will require a little bit of effort. And to collaborate with the evaluators on some selected aspects of the evaluation and of the data collection. For example, it would make sense, you know, if we appoint an evaluator to come into your university. Of course, we want to think about creative ways of promoting the study and encouraging students to participate, and the higher education provider is best placed to do that. So it's helping and collaborating the evaluator doing the actual conducting the evaluation. And it's also tasks we imagine, like digging out or sharing related outcome data for students, what Helen mentioned earlier. Maybe you have some trend data about their attainment or attendance or retention that the appointed evaluator can usefully explore, even though this is mostly a qualitative methodology that we're pursuing here. But any sort of management information data on the implementation of your intervention would surely also be useful, as well as potentially tracking data on student outcomes, such as attainment or attendance. So the ITT says we accept a certain percentage for overheads, which is 25%. So a maximum overhead rate of 25% on staff costs will be considered. Hope that answers the question, but please shout if you need me to elaborate a little bit more.
Thanks.
If not, back to you, Helen, to tackle the next question.
Would the type of outcome data available form part of the selection criteria for universities? I don't think so. I mean, what we said with the assessment of applications, which is outlined in the, I think it's in the tender and the application form, is we're looking for feasibility. So again, as we kind of touched on at the start of the webinar, so the feasibility of being able to actually carry out the work within the time frame. So I think that's probably a primary concern, is, you know, it's is this intervention, what's the word, is it appropriate? Is the intervention appropriate for the evaluation methods that we're aiming to use? So I think that's the bit that we're looking for. As I said, we are interested in the outcome data as well, but primary concern is the feasibility and actually being able to work with the evaluation, work with the evaluator in order to gain some, you know, valuable and data at the end of the project. And I think generalizability as well, I think is something that we're interested in, and the scalability as well. So what are the learnings, the wider learnings that we can take from the project and from the project findings, if it's found that the particular intervention is found to have a really positive effect, and to make a difference, what can we take from the evaluation, this intervention that's been implemented in this context with this group of students, and sort of transfer it into a different setting. So we're also interested in that. Wouldn't the institutions have to be monitored, have monitored or done any formal evaluation on the intervention to participate? Not in no. you don't have to have done any kind of informal evaluation in order to participate. I think it kind of goes back to what we were talking about at the start. We're not precluding those interventions that are new, but again, that goes to the feasibility, you know, of the intervention being able to be to set up and running with students from September. So you know, being that assurance that everything is in place for the intervention to run and for the evaluation to take place. In part, again, depending on the evaluation and the evaluation methods, because different evaluations might require some data to be available in order for the evaluation to be most effective. But no formal evaluations. But it would just be, I think it would be helpful for us if you were to indicate why you think, you know, why you're putting forward this particular intervention for this group of students. What's your rationale based on? It might be anecdotal evidence from students. It might be anecdotal evidence from other members of staff, but just some kind of evidence that you think that this is having the effect and the impact that you're looking for. Is it possible to add links to the application paperwork? Yes, we can definitely put those links in. I think.
Yeah, I've
I've
just
done
done
that.
that again.
I can do that again.
Cool. I've just done it again. Oh.
Oh yeah. Brilliant. Are you looking for proposals from HEPs and evaluators separately or together? I don't know. Separately or together?
I think separately, or you know, in principle, we are you know, kind of flexible, but the way this procurement exercise has been sort of set up, it was for us at TASER to kind of go out to the higher education sector and invite HEPs to come to us with suggestions sort of through their applications, which TASER then we would review and score along the stated criteria, and then separately we're procuring for an independent evaluator who brings in the methodological expertise that very few people have, and also the independent angle to conduct an independent evaluation, and then we match them up. So we would appoint an independent evaluator to then work with the selected HEPs on their interventions. So yeah. That's the procurement model that we have adopted for this round of commissioning. Yeah, so it is a separate procurement exercise, but I'm just doubting whether I understand the question here correctly. So yeah, please shout or post a further message in the chat if that's not quite clear.
Thank you, Christoph. The question, will the evaluation focus only on those students who have mental health issues rather than expand to those who suffer with low well-being? I think we're interested in mental health and well-being interventions that we're interested in. If so, is there sufficient data available from the universities to differentiate these students and do their programs differentiate between them in terms of provision? That's a question. I'm not sure that's a question that I can answer from a. I think that's a HEP question about that differentiation of data, and what data and different providers. I guess will have different data collection systems of what data they're collecting on their different interventions. But I would imagine if there are two, if a provider is running two interventions, one targeted on mental health, one on low well-being, then I would imagine that it would be possible to separate out who is taking part in one intervention and who's taking part in another intervention in terms of that provision, I would have thought. Any provider, do shout out with any, if you would like to come in on that. So the question is whether you differentiate students and do the programs differentiate between them in terms of that provision. So where you might be evaluating those students who have mental health issues rather than expand to those who suffer low well-being. I'm not sure, and I might not be answering correctly, but I would imagine that yes, that and we can come back to that one, that providers would be able to differentiate between the two.
Fiona, your mic's open if you want to follow up on that at all.
Oh, okay. I think, if I may, I think it's a really good question. Yeah, thank you, Fiona, for posing it. And it's something we've been discussing in the TASO team as well, that distinction between mental health or perhaps diagnosed mental health condition as opposed to well-being. And it's an important distinction for us to keep in mind and for the evaluation to be very precise about what we're looking at. So the question is really good. I don't have an immediate answer either, because that's in the hands of the HEPs, their interventions, and the data systems they have. But it's definitely something at TASO that we are well aware of, and very important to keep that distinction in mind.
Yes. Ali has her hand up. Not sure if she's able to.
Yeah, mic is unmuted, so she should be able to speak.
Sorry, I think it was an accident. It was still up from previously.
Okay.
Apologies.
We have an intervention that supports care experienced students from access to graduation. Intervention supports on 3 strands. Would it be possible to use this methodology to evaluate the wellbeing and belonging? I would say yes. My immediate response to that is yes. Because even though, so you're looking across the student journey, it's a very small cohort, so focusing on I say very, my assumption is that it's a small cohort. So yes, we would be interested in hearing that, and I think it would we would very much be able to use the smaller methodologies for that kind of intervention. Guidance. I think our ethics team are currently looking at whether we can gain retrospective ethical approval, i.e. gaining approval from students in a cohort from last year who experienced an intervention to be included in this evaluation project. So can you offer any guidance? I'm not sure what guidance you might be looking for, but I think, I mean, yeah, I would imagine that if you're, I guess, guidance would be if we felt that retrospective data was important for the evaluation, then we would need some assurance, obviously, before any kind of kickoff that there was going to be available, that data was going to be available if it was necessary for the Linda, I think it was your question. I can see you've got your hand up.
Yes, sorry. Thank you so much for answering my question. I'm just thinking, because we ran the intervention that I'm interested in working with an evaluator on last year. So we've got students who have run through it that we could then use as part of the evaluation to report on in March, which I think is good. But it means that we have to potentially have to talk to our, I think, ethics team about retrospective ethical approval for including students in that project. Is that right?
Mm-hmm.
Yeah,
most definitely.
Yeah.
I don't want to preclude that, and it's the job of an ethics committee to advise. In general,
Yeah.
in social research, when we do primary data collection, you should get the informed consent before you do something with people. But it's definitely worth exploring with your ethics committee. I've just posted a little link in this chat as well on further ethics guidance that TASO is providing in general for evaluation research purposes. But this is a very specific question. I'd really be interested, Linda, in finding out more about this. So whatever happens as a result of this process, do feel free to be in touch and let us know. Let me know.
Thank you.
Yeah.
Okay.
it also depends on all ethics. The committees tend to be different as well, don't they? And tend to have have different processes in
Yeah.
terms of responsiveness. You know, there are only certain times in which you can actually submit your ethics application. Others it's rolling. Some are quite accessible, and you can. I guess it would be useful just to, if they are accessible, just to have a and you were able to just to pose that question to them and see what they say.
I'm just trying to think what the time frame would be for the project, because the intervention will run again this academic year, so we could definitely still include it, but by March we wouldn't have necessarily any attainment data by that point. Yeah,
I think definitely worth having a chat with your ethics person to see in principle. As Crystal says, you would need ethics, but have a chat with them to find out exactly what the process would be and what that time it might be very quick. Might be one of those things where it can be expedited, if that's the right word. And there might be something they can do quite quickly. So definitely worth a chat with them.
Brilliant, thank you.
It's a linked chat. I think
There was a question about the timeline, making it quite rushed.
Yeah, I can.
Oh,
Thank
I've
you.
missed.
Thank you. I can take that. A question from Fiona. I'll just read it out. Really good question. The question is, I would anticipate that the timeline may mean it will be quite rushed to finalize the theory of change models in early August, with holidays making this difficult. And the question is there any flexibility on this? Or would it depend if you were hoping to evaluate transition programs delivered over the summer? Yeah, again, thank you, Fiona. Really good question. And, you know, the quick answer is yes, of course, there is flexibility. You know, we've outlined an indicative timeline in our invitation to tender to give HEPs and evaluators a bit of a flavor. But what actually happens will really be decided collaboratively between TASO, the evaluator, and the HEPs about what makes sense and what is feasible. So if the theory of change models will need a bit more time to be created or adapted later than August, of course, we will be flexible. The theory of change models just need to be in place before the next stage of the evaluation can commence. But that in turn will depend on when the interventions are actually scheduled to be implemented and when we can feasibly collect primary data from participants, whether that's ex post or before and after, and what other data collection activities may be in scope for the evaluation. So yeah, short answer, yes, of course, there is flexibility.
I guess ideally it'd be good to have an inception meeting, I think, wouldn't before the summer holidays, and get as much of the admin, so the admin side and the project setup before summer. But yeah, I completely appreciate that summer holidays isn't a great time to obviously be liaising with providers, and it is quite tight. But yeah,
agree with you, Helen. What's our stance, or what's your feeling? And if because Fiona is also asking about transition programs, which happen, of course, earlier. I assume you know more about this than I. Transition programs would be implemented before the academic semester starts. Is that right?
There would be. Again, it depends on the transition program, because some are pre-offer, but I mean, there might be transition programs. It could be early induction, for example. So looking at that period, so to the end of August, beginning of September. So specific induction activities for certain cohorts. But again, I think we're exactly as you said, we're flexible. So I think it depends on what the intervention is, what the timing is. But again, yeah, don't let that put you off. I don't think, you know, we can definitely build in some of that flexibility, and we do recognise that the timelines are quite tight from that September to March.
Yes. Excellent. I see a hand up from Aliki. If you want to go ahead.
Hi, yeah. Thank you. I posted earlier about an intervention strategy that we have that supports our care experience students from access to graduation, and that we've broken our intervention down into 3 strands. So we've got a wellbeing and belonging strand, we've got an academic support strand, and we've got an employability strand. We've also got a financial strand, but that's just linked to our financial support that we offer our students from care experience backgrounds. Our intervention is not just broken down by 3 strands, but it's also broken down by themes for each year. And also we have an element of that that's pre-enrollment, which is access-based. And I'm just wondering whether that's going to be too broad a scope for this particular piece of evaluation, to be looking at all of our students over that long sort of student journey timeframe, or whether we would need to pick a particular year group that we were wanting to focus on, or whether whether that's kind of going to be too broad, really.
Okay, maybe I'll go first, but Helen, please do come in. I mean, that sounds really, really interesting. Care experienced students as a group of students that we definitely want to focus on here at TASE. So yeah, that's very positive. The program that you outlined does sound very comprehensive and very long term, and we are unlikely to be able to provide a full and final summative bells and whistle evaluation of the entire effort that you put in there. But I would say we should be able to pick certain elements or aspects or timeframes of this longer term program and focus our evaluation efforts on that. Yeah. So that could be a smaller group of all the participants of your program, or focusing on one of the 3 or 4 strands that you mentioned, and a specific intervention within that, that we would select in collaboration with you and your colleagues, in conversation with the independent evaluator, who would bring in the methodological expertise and tell us, is this feasible or not, and what are appropriate research and evaluation questions that we want to create for this specific population and this specific intervention we want to focus on. So yeah, so evaluating everything is probably too big, but narrowing it down to a specific aspect of the wider program should definitely be feasible. It sounds very interesting. I would encourage you to put in an application with these caveats in mind. Yeah. So it's up to you to decide, but we often, in my experience, evaluations often look at interventions that are very big and long term, and then have to delimit, or specify the evaluation questions according to what is actually possible, what is feasible, and then the learning that can be generated from this effort is not applicable to the entire program, but only to an aspect of it. But that's still good learning. It's appropriate, and it's a good use of our resources as well. So that's my response. Helen, please come in if you wanted to add anything.
I think that that's really. I think I absolutely agree. I was going to suggest the same. If we pick a theme or an element of the within that program and focus on that. But yeah, completely echo what Christoph says, and definitely would encourage you to submit an application.
Just to say, we've got 5 minutes left until the end.
Okay, we have to talk faster. Thank you, Becky.
Would an Easter school for care experience for mixed year groups be appropriate for this attendance, also offered collaboratively by multiple HEs? Easter school.
It's probably too late.
Unfortunately,
Maybe
again,
too late.
sounds really interesting. Yeah, but I think possibly would be too late given the timing.
Yeah. Do you know why, Kriti? Because it could sound potentially really, really interesting. So perhaps we continue that conversation and maybe for another time, for next year. So yeah, let's be in touch about this. As with any other ideas or suggestions or dreams that you might have, everyone here on this call, please feel free to continue talking to us here at TASE. So even if you're intervention comes a little bit too late or is not yet up and running, because we do want to hear from everyone in the sector about interesting interventions that you're dealing with, where you can see value in us coming in and bringing in an evaluator, conducting the evaluation for you, and thereby generating knowledge to find out, what works, what has a positive impact. So anyway, so yeah, but the Easter School for this particular for this particular evaluation, we're expecting an interim report by March and then a final report later on. And probably if we wait until Easter has happened, there won't be enough time for us to, do the fieldwork and all the analysis. So it's a purely a timing issue that I would mention here.
Mm.
Yeah. Okay, so you go, Helen.
Just that one last question. Does it not depend on what your intervention is targeted at as to whether that distinction needs to happen? I haven't got the rest.
That was in response to another question that was asked around distinguishing between students who have mental health issues and those needing wellbeing support. And I was just saying, I thought maybe it would depend on whether your intervention was targeted at specific wellbeing specific mental health or wellbeing, and perhaps maybe that's when you would need to distinguish between those two different groups.
Yeah, thank you. So 2 minutes. That was good timing, wasn't it? I think 2 minutes and counting. If anyone has any last comments or questions before we sign off, but as Christoph said, do keep in touch with us about interventions, or if you have any further thoughts or questions, clarifications. That deadline is the 21st of June. So who should we contact for further info? Should that be the research inbox, do you think, Christoph?
Yeah, I think it's stated in the ITT. So do you know the email address? Helen, can we post it here quickly?
Yeah, I will. It's a researcher. I think it is in the ITT. Just make sure I get it the right way. Research at, yeah. Oops.
There it is. Great. Thank you, Helen. Oh,
Criticant.
maybe it didn't like the emoji. Okay.
It is the email address is the hello Critty. I think I know. I think we've worked together on the summer school project. Becky has just posted the email address. Is that, can you, hopefully you can see that. And the ethics guidance.
Ethics guidance.
I think maybe Becky, can you? I think it might need to be Becky that posts the ethics guidance in the chat. I'm not sure how messages are being.
I'll do that in a sec.
Fab, thank
Okay.
you.
Thank you, Becky.
Okay, there's the ethics guidance. So hopefully everyone can see that now. And hopefully everything that we've posted, people can see. So that was the invitation to tender and the ethics guidance. Okay, we're at time. Thank you very much, everyone. Fantastic questions. Brilliant to see all the engagement with the invitation to tender. As I say, do submit your questions to the research inbox by the 21st of June for any clarifications, and really look forward to reading and seeing your submissions. Thank you very much indeed, everybody, and thank you, Becky, for your support in the back room there. I don't know why it's called the back room, because it's incredibly important. So thank you very much, and thank you, Christoph, as well.
Thanks, everybody.
Thank you.
Thank you. Goodbye.
Bye.
Thanks.